The women who received these implants did so on the understanding that the implants met the requirements of the CE mark and were safe. That was not the case, and every provider has a responsibility to put things right. While the majority of women will have received their implants privately, some, such as those who have had reconstructive surgery following mastectomy, will have received PIP implants through the NHS. All of those patients will receive the highest possible standard of care. First, they will be contacted to inform them and to give them all relevant information and advice. Women who wish to will be able to speak to their GP or with a surgical team who carried out the original implant to get advice on the best way forward for them. If the woman chooses, this could include an examination by imaging. If, when informed by an assessment of clinical need, of the risks involved and the impact of any unresolved concerns, a woman with her doctor decides it is right to do so, the NHS will remove and replace the implants if the original operation was done by the NHS. Last week, the NHS Chief Executive wrote to the service, and Dame Sally Davies, the Chief Medical Officer, wrote to GPs and relevant health professionals. Copies of those letters are available in the library. I believe it is right that those who receive their care privately should also receive a similar level of service and reassurance from their care provider. However, I do not think it is fair to the taxpayer for the NHS to foot the bill for patients who had their operation privately.